Jillian Harkey says, I had a LEEP procedure, LEEP, 5.5 months ago at 3 weeks post-op, and since I've lost, Carrie, what is a LEEP? What is that?
It's a procedure where they remove the surface part of the cervix.
Okay.
And
for what purpose?
Usually it's for lesions, so precancerous lesions, or for or cancer itself.
Thanks. I had a LEEP procedure 5.5 months ago at 3 weeks post-op, and since I've lost sexual sensation and libido, can no longer barely have cervical orgasms and experience nerve pain in my pelvic muscles and legs if I put pressure on the cervix. Could progesterone and vitamin E oil applied directly to the cervix help reverse any possible post-surgical fibrosis? If progesterone safe to take to see if it helps with libido? And then she follows up, also, could sex and orgasms, I can still have a clitoral vaginal orgasm if I really concentrate, have damaged healing nerves? Could sex and orgasms have damaged healing nerves? I guess she's asking, could too much clitoral and vaginal orgasms damage the nerves in that context? Or could my own bodily environment have
Probably not.
Let me just finish. There's 2 sentences left. Or could my own bodily environment have been a perfect storm for poor healing? I don't know what is due to nerve damage, what is due to hormones. I don't know what is happening to me. Any thoughts?
So yeah, with the LEEP procedure, so like I was saying, is basically it's kind of like a hot knife through butter. So they cut away a portion of the cervix, and it depends. Sometimes it's a little portion, and sometimes they do what they call like a full like slide it right across the face of the cervix. And if you remember, for those of you who maybe have never seen a cervix, it's shaped like a donut. Like literally, it's like your cervix is this tiny little pink donut and has a hole in the middle, and the hole is leads up into your uterus. And so, for a lot of women, there's a lot of nerve sensation there, so it does greatly affect orgasms. Other women don't have it. There's probably women listening who were like, mine's not sensitive at all. Is that normal? Yep, totally normal. Every woman is different. So for her, though, in particular, she did have a lot of nerve sensation there on the cervix. So first of all, progesterone is a hormone. Never just take a hormone because you heard it's good and want to try it. Definitely, at least talk with your practitioner, get your progesterone levels checked in the second half of your cycle, the luteal phase, and see. And if then, yes, you need progesterone, then yes, girl, try it. Absolutely. And you can
try directly applying it to the cervix.
You can do progesterone vaginally. Yes. Now it's not, you would have to have it compounded because the topical creams on the market are not meant to be vaginal. They're meant to be on the outside of the skin, not the inside. So be very careful of that. You want it compounded specifically for vaginal application. There are a few over-the-counter, or there's one, I don't think they're over-the-counter. There's a company called Bezwecken, and theirs is made in coconut oil and vitamin E oil. So it is safe for vaginal purposes, but you still have to be a practitioner to get access to it. But yes, then you can use progesterone, and you can absolutely use vitamin E capsules. You can break the capsule and insert it up there vaginally to try to help. Now, I will say the other thing that I found really, really helpful for things like that, acupuncture, believe it or not, pelvic abdominal type acupuncture is really helpful. And there's specific like abdominal pelvic massage. So just like you have physical therapy for your shoulder or your knee, there are physical therapists who are specially trained in certain kind of massages to focus in and around the uterus, and it's usually all external. And so there's two kind of bigger groups. One is called Arvigo, starts with an A, Arvigo. So you can look on their website, Arvigo Massage, find the massage therapists and physical therapists who are trained. The other is the Mercier Therapy, which is Mercier. So to us it'd be Mercier, but it's Mercier Therapy. And what it does is
more
it
mercy
helps
there than most other places.
Exactly. So it helps with like nerves and congestion and muscular support in and around sort of that whole pelvic area. But yeah, you can absolutely and keep in mind you just had surgery. So, and it takes a really long time for nerves to grow back. I think they grow, like the research shows they grow back like 1 millimeter a month. And so if you just had those nerves scraped away or the ends scraped off, it's going to take months to reconcile that. It's nerves are
that sounds hopeful.
Not fast growing, but it is definitely possible. Yep. Yeah, absolutely.
All right. Thank you.
Yeah, vitamin E is a good one.
Thank you, Jillian, for your question.